So I have previously assessed the patient's height, weight, and vital signs, and they were all within the appropriate range for his age. We also previously did the Snellen chart. His vision was 20/30, so what he saw at 20 feet, a person with normal vision saw at 30 feet, and cranial nerve 2 was intact. Hi, my name is Allison. I'm going to be your student nurse today. We're going to be doing a head-to-toe assessment. Can I get you to go ahead and state your name for me?
It's Herbert.
And the date?
October 24th.
The time?
It is 10:30.
And why are you here today?
Routine checkup.
Okay, patient is alert and oriented ×4. We're going to be moving kind of quick, doing as many tests as we can. If you need to take a break at any point, please let me know, or if you need to stop for a minute, let me know. So I'm going to wash my hands before we start. And I'm going to go ahead and start with your skin. Skin is smooth and even pigmentation for ethnic background. I don't notice any lesions. Capillary refill is less than 2 seconds. I'm going to go ahead and test your skin turgor. Pull your skin up. No tinting is present, which means you have elasticity and your skin turgor is good. The next thing we're going to do is your face and your head. So your head is normocephalic, your eyes and your ears are symmetric, your nose is midline, I don't notice any drainage from your ears, your nose, your eyes, or your mouth. I'm going to palpate your head so I can get you to bend your head down. Let me know if you feel any tenderness or pain.
No.
I don't see any lesions, I don't feel masses, and I don't see parasites. Hair is distributed evenly and appropriate for ethnic background. I'm going to go ahead and palpate your sinuses. You can put your glasses right here for me. Okay. Let me know if you feel any tenderness or pain, your frontal
No.
and your maxillary.
No.
Okay. Next thing we're going to do is your lymph nodes. I'm going to palpate them. Let me know if you feel any tenderness or pain with that as well. So you have your pre-auricular, your post-auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and your supraclavicular. Okay? None of those were palpable. Did you feel any tenderness or pain? Okay. The next thing we're going to do is we're going to test some of your cranial nerves. So I'm going to have you close your eyes, and I'm going to take a cotton ball and touch your face with it. Let me know when you feel it.
No.
Okay, cranial nerve. Yeah, I'm not done yet with that. Now, you can open your eyes. I'm going to palpate your TMJ, so can you clench your teeth for me and open your mouth? Move it from side to side. Clench your teeth again. Don't let me open. Okay, cranial nerve 5 is intact. The next one is cranial nerve 7. Can I have you smile for me and frown? Close your eyes tight and don't let me open them. And blow your cheeks with air. Air escapes evenly. Cranial nerve 7 is intact. The next one, I'm going to have you shrug against my resistance and push your face against my resistance. And this way. Cranial nerve 11 is intact. So now we're going to move to your eyes. The external eye and the eyebrow, I do not notice any lesions on your eyebrow, and your eyebrows are symmetrical. We're going to do a few different things. First I'm going to measure your pupil. Your pupil seems to be about 5 millimeters. And I'm going to check the reaction to light, so just stare straight ahead, and I'm checking to see if your pupils constrict. And they do. Now, if you could stare off at the wall behind me, okay, and your pupils dilate, and now I want you to focus on my pen, and your pupils constrict. That's accommodation. And the last thing we're going to do is I want you to follow my pen with your eyes only, and please don't move your head. Okay, cranial nerves 3, 4, and 6 are intact. Now we're going to be looking at first off, your sclera is white, your conjunctiva is clear, and I'm going to go ahead and pull your lower lid down. Your conjunctival sac is pink and moist. Okay? I'm going to use my ophthalmoscope to look at the internal structure of your eye. I'm going to go ahead and have you turn this way just a tad. There you go. You'll stare straight ahead for me. I'm going to be getting kind of close, so I'm sorry about that. I'm going to come in at a 15-degree angle. I see the red reflex. I see the ophthalmic disc. It is a yellow creamy orange and it's round, and I see a paired artery and vein. You okay? All right. The next thing that we're going to do is I'm going to assess your nose. So can I have you close your eyes and occlude one nostril for me, and tell me what you smell.
Alcohol.
And the other one?
Alcohol.
All right. Cranial nerve 1 is intact. The next thing I'm going to do is palpate your nose. Let me know if you feel any tenderness or pain.
No.
Okay. So now I'm going to use my otoscope to look at the internal part of your nose. Okay, so can I have you tilt your head back a little, and I'm going to push your nose up some. I'm going to insert it. Okay. I see the nasal mucosa is pink, moist, and smooth. The inferior turbinate and the middle turbinate I can see, and I can also see that there is no deviated septum. Okay. Now we're going to move to your mouth. I want you to go ahead and close your eyes and stick out your tongue and tell me what you taste. I'm just going to put a little bit on your tongue.
Sugar.
Okay. Cranial. Now I need to check your gag reflex.
Okay.
I'm going to test another cranial nerve with this. Cranial nerve 9 is intact. Now I want you to stick out your tongue and say "ah" for me. Okay. Your uvula is midline, your soft palate and your uvula rise symmetrically. Cranial nerve 10 is intact. Your tonsils are at a 1+, they're pink, and I noticed some crypts. You can go ahead and stick your tongue back in your mouth, keep your mouth open. 28 teeth are present. I do not notice any dental caries. The hard palate is white and the soft palate is pink. I'm going to go ahead and move your cheek. The Stenson's duct is patent. The buccal mucosa is pink, smooth, and moist. Okay? Now, I'm going to have you, can you say light, tight dynamite for me?
Light, tight dynamite.
And stick out your tongue and move from side to side. Okay? Your tongue protrudes midline and cranial nerve 12 is intact. Next, we're going to move to your ears. I'm going to perform a few tests before I actually assess the inside of your ear. The first one is the whisper test. I want you to close off one of your tragus, and I'm going to go behind you and whisper something. Let me know what you hear.
1, 2, 3.
Very good. I would repeat for the other side, and cranial nerve 8 is intact. The next test we're going to be performing is the Weber test. I'm going to strike the tuning fork, place it on the center of your head. Let me know if you hear the vibrations better in one ear than the other, or in both equally.
Equally.
Okay. Vibrations were felt bilaterally. The next test is the Rennie test. I'm going to strike the tuning fork, place it on your mastoid process behind your ear. Let me know when you can't hear it anymore, and then I'll put it in front of your ear and let me know when you can't hear it anymore again. Okay?
No. No.
Okay. Air conduction is twice as long as bone conduction. That's what I was looking for. Now we're going to actually assess your ear. I'm going to start by, you can turn a little sideways for me. I'm going to start by palpating your pinna and your tragus. Did you notice any tenderness or pain? Okay. I don't notice any lesions, and the external part of your ear is not red. So I'm going to use my otoscope, and I'm going to look at the internal structures of your ear. So I'm going to have you, I'm going to pull your ear up and back, and I'm going to insert it. Then I notice I see the tympanic membrane. It's pearly gray and it is intact. I see the umbo, the manubrium of the malleus, and the short process of the malleus, and I do not notice any redness. The conal light is also at 5 o'clock. I would repeat this for the other side, and the left ear would have a conal light at 7 o'clock. Okay? Now we're going to go ahead and move to your throat. If I can have you look up for me. Your trachea is midline. Okay? You can put your head back down. I'm going to palpate your carotids. Okay, both of those were out of 2+. That's what I was looking for. I'm going to go ahead and use my stethoscope to auscultate for any bruits in your carotid. And since I don't have a bell, I'm going to use light touch. Okay, I would repeat that for the other side, but for this side I did not feel any bruits. Now, if I can have you turn just a little bit this way. I'm going to palpate your thyroid. I'm going to put my hands around your neck, and I want you to bring your head forward and swallow. Alright, and to the other side and swallow. Okay, your thyroid gland was not palpable. That's what I was looking for. If I can have you turn just a tad more. Okay. The next thing I'm going to do is perform tactile firmitus. Every time you feel my hands, I want you to say the words 99.
99, 99, 99, 99.
Okay. Felt bilaterally. The next thing is respiratory excursion. I'm going to put my hands at the bottom of your rib cage, and I want you to take a deep breath in and exhale. Okay, hands rise symmetrically. The next thing I'm going to do is percuss your posterior part of your chest. So I'm going to get my hammer. I'm going to lift your shirt up.
Okay.
Okay. I'm going to percuss in the intercostal spaces. Okay. Resonance was heard. That's what I was looking for. The next thing is CBT. Let me know if you feel any tenderness or pain, please. Okay, no CBT. Now I'm going to auscultate your lung fields. I'm going to listen for some breath sounds. So I want you to take a little bit deeper breath than normal, but if you feel like you're getting lightheaded or you're going to pass out, let me know and we can take a break. Okay? One more. And the last one. Okay, no adventitious sounds were noted. Are you feeling okay? Not lightheaded? Alright. You can go ahead and put your shirt back down. And I'm going to have you swing your legs back around for me. And I'm going to listen to your heart sounds. So I'm going to need you to lift your shirt up for me. And for listening to the breath sounds and the heart sounds, I would use the diaphragm. So we're going to start with your aortic valve. It's going to be the second right intercostal space, right sternal border. Next is pulmonic. It's going to be your left second intercostal space, left sternal border. Next is your tricuspid valve, and that's going to be on your left lower sternal border, fourth ICS. And the last one is your mitral valve. It's going to be your fifth ICS MCL. Okay, you can go ahead and put your shirt down. S1 and S2 were noted. That's your normal love dub of your heart. I did not notice any extra heart sounds or no murmurs. So the next thing we're going to do is assess your pulses. So I can go ahead and have you straighten your arms out. Your brachial and your radial. Your dorsalis pedis, and then your posterior tibial. Okay, those were felt bilaterally, and they were all of them were out of 2+. The next thing we're going to do is assess your abdomen. So I'm going to go ahead and have you lay back for me. Put your head on the pillow, and I'm going to pull this out. Okay, go ahead and lift your shirt for me. Contour is flat, umbilicus is inverted and midline. I'm going to start by auscultating your abdomen for bowel sounds, starting in the right lower quadrant. I would use the diaphragm side for this. Okay, your bowel sounds were present. So now I'm going to auscultate for any bruits, starting with your aorta, and I would use the bell for these. And then your renal, your other renal, and then your iliac. The last iliac. Okay, no bruits were noted. The next thing we're going to do is percuss, and I actually need my hammer. I'm going to percuss 3 times in each quadrant, starting with the right lower quadrant. That one didn't do so well. There we go. Okay. Tympany was heard over your intestines, and dullness was heard over your liver and spleen, and that's to be expected. Okay. The next thing is light palpation. I'm going to warm up my hands so they're not too cold for you. And I'm going to start in your right lower quadrant using my 4 fingers and 1 broad swoop. Did you feel any tenderness or pain? Okay. I didn't palpate any masses. The next thing is deep palpation. I'm going to push a little bit harder and let me know if you have any tenderness or pain when I get done. I'm going to do this 3 times in each quadrant, starting with your right lower quadrant. Doing okay? No tenderness or pain? Okay. No masses were present, and I couldn't palpate your liver and your spleen, which is what I was looking for. So I'm going to go ahead and pull your shirt down. You can go ahead and sit up. The next thing we're going to do is I'm actually going to test your deep tendon reflexes. So we're going to start with your bicep. And go ahead and relax your arm. Okay, and your tricep, relax your arm. Okay, and your patella, then your Achilles. Okay, all of those are at a 2+, and I will repeat for the other side. Next thing we're going to do is some range of motion exercises. I'm going to start with your neck and have you flex your head down, extend your head up, lateral bend to the right and lateral bend to the left, and rotate your head to the right and rotate it to the left. Any tenderness or pain? Okay, I didn't feel any crepitation. Full range of motion. Next is your elbow. I'm going to have you flex your elbow forward towards you and extend it away from you. Pronate your palm down and supinate your palm up. Any tenderness or pain? Okay, no crepitation was noted, and that was full range of motion. Next is your wrist. I want you to flex your hand down, extend your hand up, radial deviate in, and ulnar deviate out. Any tenderness or pain? No crepitation was noted, and full range of motion. The next thing is your ankle. I'll use this one. I want you to plantar flex your toes down, dorsiflex your toes up, invert your sole, and evert your sole. Any tenderness or pain? Okay, no crepitation was noted with that, and that is full range of motion. I'm going to go ahead and have you stand up for me. And we're going to do it for your back now. I'm going to place my hand on your lower back. Turn this way, just a tap. Okay, and if I can have you flex forward, extend back, right, lateral bend to the right, lateral bend to the left, rotate to the right, and rotate to the left. Any tenderness or pain? Okay, I didn't feel any crepitation, and you had full range of motion. The last one we're going to do is your knee. So I'm going to go ahead and place my hand on your knee, and I want you to flex your knee back and extend it forward. Any tenderness or pain? Okay, no crepitation was noted, and full range of motion. And for those, I would repeat for the other side if it was necessary. While I have you standing, we're going to go ahead and perform the Romberg test. I want you to stand with your eyes closed, and I'm going to watch for any swaying for 20 seconds. Okay, 20 seconds has gone by. That was a negative Romberg test. That's what I was looking for. I'm going to have you actually come over here for me. And the next thing is tandem walking. That is walking in a heel-to-toe fashion. I want you to walk from there to about here, you going in heel-to-toe. Okay, balance was maintained and patient walked in a straight line. You can go ahead and have a seat again. Just a few more tests and then we're done. The first one is a rapid alternating movement test. I want you to touch your pointer finger to your thumb and then the next fingers, and then go back and gradually get faster and faster, able to do quickly and accurately. Now we're going to perform stereognosis. I want you to close your eyes and hold out your hand and tell me what you feel. Object was identified correctly. And go ahead and keep your eyes closed, and I'm going to write a number and tell me what number it is.
6.
Number was identified correctly. Now I'm going to check my notes. seeing anything so far. Okay. We're going to test your muscle strength, so I want you to hold out your arms for me and pull against my resistance and push against my resistance. That was a 5, and same thing with your legs, push and pull. Okay, that was a 5 as well. I think I'm done, so that concludes our assessment for today. Thank you for coming in, and I hope you have a good day.